Hi, my name is Dr. Joanne Gerenser, and I'm here to sort of help people understand what autism is. Autism is a neurological disorder that affects 1 out of every 110 children born today. It's part of the autism spectrum disorders, which typically includes Asperger's disorder and pervasive developmental disorder not otherwise specified. What the three disorders all have in common is that they greatly affect communication. So an individual on the autism spectrum will have difficulty with language. They'll have difficulty understanding what people say to them, and they'll have difficulty communicating to others. That can vary greatly. So some people with autism are nonverbal, meaning they can't say anything and understand very little, all the way up to others on the autism spectrum are quite verbal, speak quite eloquently, yet still have a difficult time, let's say, with social language or with abstract language. The second area that's very much involved in all of the autism spectrum disorders is social skills. So individuals on the autism spectrum have a very difficult time with social situations. Again, this will vary greatly. Some individuals with autism are quite isolated. They prefer to be alone, and they will engage in behaviors to push others away and appear unaware of others in the environment, all the way up to individuals with autism who really want friends, who really want social relationships, but don't know how to do it. They don't know how to read social information. So something that we take for granted, like a facial expression, is a mystery to individuals. Typically, those would be individuals on the Asperger end of the spectrum. They have a difficult time reading social situations and social cues, which in turn makes it difficult for them to understand how to navigate the social world. The third area that's involved in all of the autism spectrum disorders has to do with behaviors. And these are typically areas of repetitiveness. So you'll see the lower end of the spectrum, they'll engage in behaviors that are more common to autism, such as rocking or flapping their hands. But again, it can go all the way up to the higher end of the spectrum where individuals may perseverate on topics. So they may obsess on the weather, or they may obsess on license plates. But for the most part, those three areas, communication and language, social skills, and the areas of behavior. In essence, what autism is it's a learning disability. In other words, infants that are born with autism have a difficult time acquiring those basic things that typically developing babies acquire, such as looking at people and playing these interactive games that infants do, and in the long run, that's what then impairs their ability to learn language and their ability to learn the social rules.